Welcome, everyone, and thank you for joining us for our final Kids and COVID conversation. I'm Bruce Leslie, president of First Focus on Children. Over the past month and a half, First Focus on Children has hosted a series of conversations to bring awareness to the impacts of the pandemic on children. The COVID-19 pandemic has affected nearly every aspect of a child's life. Our goal in this series was to bring awareness to these different challenges and uplift the policy solutions that brought relief to kids at a time when it was desperately needed. You can watch all the conversations in the series at firstfocus.org/KCC. We want to thank everyone who tuned in to watch these conversations, our panelists and members of Congress who participated, and the Packard Foundation, the Robert Wood Johnson Foundation, Wellspring Philanthropies, the Oak Foundation, GHR Foundation, and the Annie Casey Foundation for supporting this work. We look forward to working with all of you, as well as congressional and administrative leaders who continue to create progress for kids. Today's conversation will discuss the impacts of the pandemic on schools and child nutrition. While there are distinct pandemic impacts to both of these areas, these two sectors came together to adapt and ensure that children and families receive the nutrition benefits they needed during school closures. It is because of this collaboration we choose to host a conversation looking at these two areas together. There's likely no one better to speak on the successes and lessons learned over the past 2 years in this area than our guest today. Stacy Dean serves as the Deputy Undersecretary for the Food, Nutrition, and Consumer Services Division at the U.S. Department of Agriculture. Also known as FNS, they oversee 15 nutrition assistance programs, including SNAP, and the school lunch program. Prior to joining the Biden administration, Stacy Dean served as Vice President for Food Assistance Policy at the Center on Budget and Policy Priorities. We are grateful to have her share her insights to today's conversation. Welcome, Deputy Undersecretary Dean, and thank you for joining us today.
Oh, Bruce, it's so great to be here. Thank you very much. Really appreciate being part of the conversation.
Absolutely. As you know, you were very involved in this. USDA has adapted over the past 2 years of the pandemic to ensure children don't go hungry. What were the agency's biggest successes over this time, and how can we continue to build on this moving forward?
Oh, that's a great question. Well, I think some of the agency's biggest successes were, of course, the program successes. SNAP, because it's an entitlement program, in those first few months of the lockdown was able to flex and add millions and millions of individuals as they lost employment and income, which was it's the same as Medicaid. The ability to flex was really important. And Congress provided extra benefits, extra resources through SNAP. So it was a way to quickly deploy and put money directly in the hands of households who needed them. I think we saw the same with pandemic EBT, which was the program available to households with school-age kids where there were school closures. That, of course, took a little longer because it was a brand new program, but yet it stood up a brand new program in every state, and it's deployed over about $50 billion to families. I think another key innovation and inspiration for the future was the ability to adapt and pivot quickly, right? So schools, and I just cannot thank school food leaders enough. While certainly there was some disruption early on, they immediately sought to pivot to, instead of serving meals at schools, provide grab-and-go meals. They care so deeply about the children that they serve, and they knew that tens of millions of kids couldn't learn at home if they weren't well-fed. So I think those are two really big lessons. I'd say another adaptation is the way we were able to grow online shopping as an option through SNAP. So we've got a lot of those across the agency, and where we have key learnings, we want to make sure we're bringing them forward to the post-pandemic era.
No, those are all incredible things you all did. And you mentioned pandemic EBT, and just for our audience who may not be familiar with what that is, can you describe that quickly?
Oh yeah, thank you. So it's because schools closed, and it was incredible that schools made grab and go meals, meaning families could go to the school and pick up meals and take them home. But that wasn't perfect solution for a lot of families. So Congress created a brand new program called Pandemic EBT, which allowed states to issue basically a SNAP-like benefit card. I'm holding my hand up as if I were holding a card, and load it with the cash value of what school breakfasts and lunches would be. So basically deploying resources to families with school-aged children to cover their lost meal costs. So brand new program, and was rolled out within months, and really got a lot of help to families who had those extra costs during the pandemic.
No, absolutely. I mean, the feedback we had throughout the pandemic is what an enormous benefit that was to people, and how important it was to their kids and families. So that's awesome. And then also, I just want to ask you, the waivers issued by the U.S. Department of Agriculture helps provide flexibility to nutrition programs in order to get kids fed when school buildings were closed. So like the pandemic EBT. They unfortunately were not renewed through Congress, and advocates and USDA have been vocal on how we need to get them extended. What actions that are regulatory can USDA take independently to ensure children get the nutrition benefits they need?
Yeah, so I guess let me frame out what I see as the issue here. So as schools were going back early in the pandemic and then in this past school year, right, their kids are back at school, which is where they need to be by and large. And I'm sure you'll have a strong conversation about that. But school food programs had to adapt to either public health considerations, distancing, serving meals in classrooms, and also the fact that the supply chain really disrupted school food leaders' ability to order and get food as they might have expected to pre-pandemic, right? I think we've all experienced some of that supply chain disruption. So we were able to offer through temporary flexibilities that Congress gave the Secretary of Agriculture. We were able to increase reimbursement rates for meals because we knew that the costs schools were facing were quite a bit higher. And we were able to allow them to adapt service. One of the ways that parents probably experienced this is that they saw that meals were universally free across the country in school food, and normally it's a program where we target free meals to particularly low-income households. But that was actually a great. It was good for families, but it was also really good for schools because that gave them a lot of flexibility in how they served the program. Anyway, as you point out, these temporary flexibilities expire on June 30th this year. USDA has asked Congress to extend them because we know that schools still face really difficult, probably some difficult months ahead with respect to rising food costs, difficulty with getting enough labor, and we're really worried that we haven't set up schools up for success this fall with respect to the school food programs. And we're deeply disappointed that Congress did not extend these flexibilities. So we're going to do everything we can with our authority to help schools. But I want to be really clear, USDA's waiver authority and flexibility, our toolbox is pretty limited. We'll use every tool in it, but it's not going to look next fall like it did these past months of the school year. And so in principle, I guess I would say what's really important to us is to make sure that schools can adapt to COVID pandemic conditions, that we keep kids healthy and safe. Where we have the ability for high poverty schools in areas with high concentrations of poverty to serve meals universally free, we're going to be as flexible as we can there. And then finally, no school food leader should be penalized because the truck didn't show up with the particular kinds of foods. We have a pretty rigorous nutrition standards in school meals. And if even down to the color of your vegetable varieties that you serve in any given week. And if the yellow vegetables didn't show up, but you've got green and red vegetables, we don't want anyone to face a penalty for not meeting the standards. So that's something we're really going to be looking at. So that gives you a sense of we're deeply concerned about the program. We really hope Congress gets back to the table and gives us the flexibility that we feel the school food program needs. But if they don't, we'll do everything we can. But it's going to be disruptive, and we're going to need your help in explaining to parents why the program is struggling.
Yeah, no, absolutely. We will continue to work hard to try to get Congress to take those actions, and very important to schools, families, and children, obviously. So thank you for all the work you're doing there. And also wanted to ask you, as advocates are well aware, for many children in this country, school meals can be the most nutritious meals that kids get. How can we best support school nutrition programs and staff as they strive to provide healthy food for students?
Well, you're right. We have research that shows that the school food environment is the healthiest food environment, and basically that kids experience. And that's because we have strong nutrition standards that ensure that school food aligns with the dietary guidelines, which unfortunately most of us don't eat according to the dietary guidelines. So we're going to actually be revising those standards as we're required to under law to reflect the new guidelines that came out in 2020, and we'll be rolling that out this fall. And I think I think we would love for your participation in that conversation. We want school food to build on its current strength, get even better. And it's just imperative that we do that. Diet-related disease is such a serious problem in this country, and so many children are at this point, given the way our food systems are not set up for success with respect to healthy eating. So we need to do our job in school food. And I just think when I think about the First Focus family of your extended family of groups around the country, calling for the best for our kids, right? Seeing healthy meals in schools is absolutely related to good health, and finding ways, hopefully, to incorporate parents into this conversation. Parents want their children to have the best, right? But they don't always know how to engage in these kinds of policy conversations. How do we take their desire for good health and good school meals and turn that into power so that we can make sure we're doing the best that we possibly can?
We also know that not all communities have easy access to healthy and affordable food sources. What is USDA doing to ensure more equitable access to nutritious food for all children? Sort of like, both sort of kind of food security and nutrition security issues that you all deal with.
Yeah, well, we know we have a great platform of programs, but we also know we can do better. So as I work with the team on how we can strengthen, we are working, I'd say, under four basic questions. One is, how can we increase access? A good example is WIC. We've actually seen a declining share of eligible families participating in WIC. So what do we need to do to make sure our doors are wide open? We know that many immigrant households and immigrant communities don't feel safe. How can we address those issues? We know that there are transgender individuals who don't feel that our programs are accommodating and welcoming. And another issue I've actually worked on for a number of years is homeless runaway youth, right? We've got to make sure that our doors are open. So those are some examples. The other thing is reach. So it's one thing for our door to be open. Another question as to whether our programs are reaching into the communities as far as they can. And we're particularly focused on remote and rural. But it's really important that we don't just keep talking to the same folks that we normally work with, who likely are giving us information about how well everything is working. We've got to spend some time with folks that aren't working with our programs and hear why, so we can expand reach. We've got to think about adaptation. That's a key lesson from COVID. And a good example would be, for example, in our food distribution programs, the way we buy and deliver food to the emergency food system like food banks. We tend to buy in huge volume, right? A truckload full of food. Well, does that help a really remote area? What about kosher and halal foods? What if a small food bank serving a particular community needs specialized foods but can't manage a whole truck? How do we adapt to those issues? And then finally, it's really important that we look internally. What is our own capacity to support an equitable review, improving equity, reducing disparities? we're the same people at the agency from 5 or 10 years ago. So we've got to take on our own internal conversation about improving equity and inclusion at FNS and then at USDA, and of course then through our programs. So that's how we're going about it.
No, thank you so much. Well, I just want to thank you and all the work that you all doing at USDA. I think this conversation is really important because even I didn't know the full array of things that you all are doing until you sort of really dive in, and it's critically important to kids. They're eliminating child hunger and improving their nutrition absolutely improves pretty much every aspect of their lives, their health, their education, their safety, et cetera, and so it's fundamentally important to them. So thank you for all the work you're doing and for always being such a great champion for kids in this country. So thank you so much, Stacy.
Thank you, Bruce.
I now turn it over to Olivia Gomez, our Director of Health and Nutrition Policy, and Connor Sassner, the Director of Education and Child Policy Research, to continue with the rest of today's panel discussion.
Thank you for joining us. As Bruce had mentioned, we're going to be talking about how COVID has impacted schools specifically and school nutrition. So I'm going to go over some housekeeping details for how you can participate with the panel today. So it's live and we'll be taking audience questions at the end of the conversation. If you registered and are watching in our closed door session, you can submit a question for our panelists using the chat feature on your right. If you're tuning into our website or one of our social media channels, you can participate in the live conversation by using the hashtag #KidsInCovid. Post your tweets with the hashtag to submit your questions. Okay, so now we're going to move on to introducing our 3 excellent panelists. So first, I'll start off by introducing Dr. Katie Wilson. Dr. Wilson serves as the Executive Director of the Urban School Food Alliance, which was created by school food service professionals in 2012 to address the unique needs of the nation's largest school districts. Before joining the Urban School Food Alliance, Dr. Wilson spent 23 years as a school nutrition director in 3 Wisconsin public schools, 5 years as executive director for the Institute of Child Nutrition, and 2 years as USDA Deputy Undersecretary of Food, Nutrition, and Consumer Services appointed by President Obama. Dr. Wilson is considered one of the top experts in school nutrition, so we're very grateful to have her join us today to talk about the impacts on school nutrition. And I'll pass it off to Connor to introduce our other 2 panelists.
Hi, everyone. My name is Connor Sassner. So I'll be introducing Robert Boyd now. Robert Boyd serves as, here we are. Hi, Robert. He serves as the president and CEO of the School-Based Health Alliance, which works to improve the health of children and youth by advancing and advocating for school-based healthcare and health centers. He's the son of a teacher and the father of another. And most of his work for the last 20 years is focused on supporting and advancing public education and health supports for students within schools. Robert has extensive experience with youth as a minister to families, a hospital chaplain, and a coach for multiple sports teams. And in past roles, he's helped to pass legislation in 4 states. Robert, thank you so much for joining us.
Welcome.
Jose, we have Jose Munoz. Serves as the director of the Coalition for Community Schools and the vice president for Equity and Impact at the Institute for Educational Leadership, IEL. Jose has over 25 years of cross-sector partnership experience with youth, family, and community development across the U.S. Before joining IEL, he was the ABC Community School Partnership Executive Director, and during his time, he tirelessly worked to serve children in Albuquerque and across New Mexico. And thanks for joining us, Jose.
So I will hand it off to Dr. Wilson to present on school nutrition. So,
great, thank you, and thank you for inviting me to this very important conversation about kids and what happened in COVID and how they were impacted. So many times we talk about how all of the adults were impacted, but I think children are sort of that silent voice that we don't really know how much was impacting them as this stress continued to build for them. So I am here on behalf of the Urban School Food Alliance, representing 18 of the largest districts in the country and their school nutrition programs. And I'd like to talk a little bit about beyond COVID chaos, because we want to begin to look back, see what we've learned, and then step forward. We want to make sure that we begin to think about how can we reorganize and reset for all of these millions of children that attend our public schools across the country. And so I think we know that the school lights went off suddenly, and families and children in particular were in a panic. These children counted on their school meals for both eliminating hunger, and they counted on them for probably the primary nutritional quality of their meals throughout the day. And so they had sort of a double whammy at them, that what's going to happen now? Schools have closed. And so there was this panic that ensued as to what are we going to do next? Where is that next meal going to come from? And that stability of knowing that food was going to be there all of a sudden was wiped away in an instant. But as we begin to look back, I think it's really important that we concentrate on so many of the things that happened that were there to protect their well-being. So many of the people that surrounded them, that whole issue of it takes a village. I truly believe it was a village that came together to take care of children. And let's look at impacting children in positive ways. I love to show this slide. This is actually the school district of Philadelphia. This is what school nutrition directors were going through. So you can imagine what families and children were going through. So school nutrition directors, all of a sudden schools stopped. Then they were opening some schools, closing others, moving sites, deciding whether we can even serve food from within a building. Do we have to be outside? Some of our districts had to buy tents so that they could serve food and keep their employees safe from the weather because they weren't allowed back in buildings. And so it was this on again, off again, opening and closing, and getting information to parents became almost impossible. How were we supposed to incorporate all of this information to parents and guardians so they knew where food would be available? And where could these children be during the day? So many of them had temporary situations. They were placed in a lot of different situations where maybe they could get Wi-Fi. I know we saw one newscast one time where the two little children were sitting on the curb at Taco Bell so they could get Wi-Fi. Well, how are we supposed to get a meal to them on the curb at Taco Bell? So all of these things, and I think this slide really shows well the chaos that was ensuing on what do we do now? And I know from the standpoint of child nutrition, all of these people that work in child nutrition said, how are we going to feed our children, our communities? They took it personally that all of a sudden these children didn't have access to food. And I want to remind you that many of these child nutrition employees were there ready to serve without any protection for themselves. They knew that COVID was hitting. They were worried about their own health, and yet they stepped up and came to work to make sure that children had access to good food. So we look at the next slide and we say to ourselves, a bolt of lightning hit. It hit us all. Everything changed in an instant. And this is actually a real picture of the Washington Monument right after they reopened, after they installed a new elevator system. And I sort of look at this, and this is exactly what happened to children. They installed this new elevator system, kids were going to school, everything was doing well, and a bolt of lightning hit, and then the entire thing shut down. And so we have to think about this and the energy that it produced and the stress level and the fear that it produced and what happened to these children. So let's take a look at some of the things we did to mitigate that fear. First of all, school nutrition employees turned on a dime and they started feeding children curbside within 24 hours of COVID shutting down those schools. That was not an easy task. We did not have food that was ready for grab and go, but they figured it out like they do all the time. And these are some great pictures of the way they did it and the way they turned their cafeterias into production centers. But there were lots of impacts, lots of barriers for children and families to get food. The cost of the indecision and delays, there was on again, off again. Can we feed them? Can we not? Are we going to get reimbursed? How do we do this? Language barriers were huge for all of these families. to figure out where and when they can pick up these food items. Storage and refrigeration became a real problem for the school districts and the families as well. Many of these children were homeless. Where are they going to put all this food that all of a sudden they were beginning to get? And then, of course, we had the supply chain disruptions. Many of our schools didn't get deliveries, and if they did, they had no idea what was on the truck. So trying to explain to families what these foods were that they were not familiar with. But we turned that corner, and we'll show you on the next slide what we did that positively impacted these families. First of all, it's a per meal reimbursement rate that school nutrition programs are under. The kids come to school, they go to breakfast, they go to lunch, they might be staying after school for a snack or a supper, but we had to do something different. We couldn't expose all these people to coming to school 3 or 4 times a day, and many children couldn't do that. So the school nutrition departments thought very creatively, got together, collaborated, and they began weekly food boxes. It was a week's worth of food. And then they thought, well, look, we need to do more and more fresh fruits and vegetables so that these kids are getting also the nutrition. Again, not only hunger, but good nutrition value. Working side by side with community groups, all of a sudden the silos went down. Working with the school busing system, working with food banks, working with faith-based organizations. Where do we find these children? We even had school districts that contracted with the city bus service just to get food out to kids that couldn't get to these sites to get this food. And then the families face the familiar faces to help children deal with the stress. The school nutrition employees are always some of the favorite people that school kids interact with during the day. There's no test, there's no homework to turn in, just a familiar face giving you a warm, healthy meal. And so these familiar faces that came out to make sure that kids knew it's going to be okay. Things are going to begin to get back to normal. I think the power of this, people really have to understand that seeing those faces they were used to every single day at school told those children, it's going to be okay. And if you need something, come to see us. And families did. These food sites became really sites for families as a whole to come and tell the school system what the challenges were. And in the school systems, through the school meal programs, tried to connect them to other resources to make sure they weren't going homeless, they weren't getting kicked out of their apartments. We saw thousands of families come to these food sites that had never asked for help before, and they were at a loss. So these familiar faces, I just can't stress that enough, how these children really began to be happy again and were comfortable coming to these people they knew on a daily basis. But these weekly boxes of food really helped ensure families that things are going to be okay and that you're going to be able to eat. And it was healthy food that they were familiar with, because many of the food boxes also were culturally appropriate for the families they were serving. And so I'll close with this, that we were trying to put things back in order, trying to give kids and families some sense of normalcy, letting them know we're here for you, even on weekends, even on holidays. We know you're not in school, but we're still here for you. And be able to get that food and that nourishment. We all know that food is an emotional thing. And so we needed to have a variety of service models. We served in the evenings, on weekends. When could parents come to get food? And all over the cities, so that it was really easily accessible to these children. And that was one less stress they had in these things. And we will now begin to start anew. And I love this quote, and it says, "This is not the time to force yourself to do the things you always did. If it's not working, accept it and give yourself permission to do it differently." And that's exactly what these school nutrition programs did to give these children a sense of normalcy. Thank you.
Thank you so much, Dr. Olson. That was so interesting to hear. Now we're going to turn to Robert Boyd, who will discuss school-based health programs and how they continue to serve students throughout the pandemic. Thank you. Take it away.
Thank you, Dr. Wilson. It never ceases to amaze me the things that our policymakers put on the backs of our educators and expect them to do, and yet we do. I'm going to talk a little bit about school-based health and school-based health centers. We're a 25-year-old organization. Every 3 years for the last 20 plus years, we've done a census evaluating what's going on out there in the school-based health center world. In 2020, obviously, that was prohibitive. So in 2021, we went out and did a survey to find out what the pandemic's impact has been on school-based health services through school-based health clinics. I'm going to share some of the results of this with you today, and you can find the full survey on our website at sbhforall.org. We're presently doing the census we should have done in 2020, and that report will be out in the next 6 months at the latest. All right, let's go to the next slide. A little bit real quick about the School-Based Health Alliance. Like I said, we've been around since 1995. We are a 501c3. We do a lot of policy and advocacy work. We also address best practices and share those with clinicians and administrators. We collect data and work with research organizations all over the country, and we provide technical assistance and training to folks at school-based health centers. We can go to the next one. We believe in the transformational power of the education system, and particularly when health and education come together. We believe that all children and adolescents deserve to thrive. Too many struggle. They lack equitable access to healthcare services. School-based health care is the solution, bringing healthcare where the students spend the majority of their time in school. And when health and education come together, things happen. There's all kinds of data out there from the CDC, from the Community Preventatives Task Force, that talks about attendance being improving. Conditions like asthma and diabetes are managed better. Everybody's talking about mental health and behavioral health right now, and we're looking to focus on getting quick expert attention to those students that need them. And most importantly, we all know healthy students learn better. And so that's a real critical factor in what we do. Let's go to the next one. What's a school-based health center? It's a shared commitment between a school, a community, and a healthcare provider to support students' health, well-being, and academic access by providing preventative, early intervention, and treatment services, again, where the students are in school. We can go to the next one. There's all different ways to deliver care, and we'll talk a little bit about how some of this changed. Pre-pandemic, 75% of the 3,000 school-based health centers in the country were traditional models. They had a nurse practitioner or a physician or a physician's assistant. They had a behavioral health specialist, usually a master's level person, and they might have been able to deliver oral and vision care. Another model is what we call the school linked, and that's where there's a clinic nearby and the students are easily able to facilitate getting them to and from that remote clinic. Another, some of you may have seen, is a mobile van where it pulls up on site and delivers those services on a rotating basis at different schools. And then there's telehealth. In the past, we looked at telehealth exclusive, that there are some systems in North Carolina, in Dallas, where they are delivering healthcare to the schools solely using telehealth. We view telehealth as a tool in the physician's black bag and in the provider's black bag, and is not unto itself a solution to school-based healthcare, but it definitely is a tool that proved to be very, very beneficial to have on hand during the COVID experience. Let's go to the next one, please. Who are the community health providers that are working with schools? The majority of them are federally qualified health centers. In some markets like Louisiana, the school systems actually provide the school-based health centers and then contract with other providers. Oftentimes people are contracting with hospitals. Delaware does a lot of this, where the hospital system is providing the workers in the school-based health center in the school. Some situations, mental health agencies have stepped in and said, okay, we're going to start working more prominently in schools. There are some that are run by nonprofits, and then there's kind of a catcher of the last few percent. Let's go to the next one, please. During the 2021 school year, a majority of school-based health centers stayed open. That's critical. In some situations, they were ordered to close by their superintendents, and they refused. It was easier if they had their own side door that people could come in and out of. But if they were in a building that the building shut down, as Dr. Wilson was talking about, then the school-based health center was forced to close. For the most part, school-based health centers stayed open and met the needs of their constituents. Let's go to the next one, please. What were the challenges that they faced? The first challenge was engaging students. You have to understand, most school-based health centers are in Title I schools, which we hope soon will all be community schools. And you also need to recognize, and I recognize that Dr. Wilson represents a lot of the largest school districts, but if you took all of the rural schools and you put them in one school district, you'd have the poorest school district in America. So this is not an urban versus rural. This is an economic issue. And if they were students from low-income communities, it was a very difficult thing to reach them, even if you had telehealth, because they might not have had access, as Dr. Wilson pointed to the two children sitting on the curb at Taco Bell. In other situations, challenges, the schools were closed. Staffing was a huge issue in that the federally qualified health centers and the hospitals and the public health agencies drew their people back to their primary locations to help address the COVID crisis. And that left staffing at the schools secondary if they were even able to staff them at all. A lot of the hospitals in particular lost tremendous amounts of money when they weren't able to do elective surgeries. So the sponsors suffered financial losses. And then there were also revenue losses to the federally qualified health centers because they just weren't seeing as many patients. And a lot of states pre-pandemic did not allow telehealth reimbursement. Let's push on. Let's talk about primary care for a minute. What did they do during the COVID? A lot of them began using telehealth. A lot of them had never used it before. They expanded the telehealth in many situations, piggybacking on the work that their colleagues were doing around the country, providing them with free technology and free technical assistance to learn how to do that. They did a lot of COVID testing. We didn't do COVID testing and COVID vaccines before the pandemic. So that was a very new add-on to a lot of school-based health providers. They were also forced to reduce hours or staffing, again, because they were pulled back to their primary care facilities to serve there. Let's go to the next one. Mental and behavioral health. A lot of them turned to telehealth for the first time. Telemental health has really expanded. It's giving us the opportunity to provide behavioral health care in communities that don't have behavioral health care professionals to serve. It also, with telehealth, enabled us to, and technology, it enabled us to further the professional development and provide consulting to some of the school staff, because again, a lot of them were not familiar with how do you do a conversation with a student or a group of students over a telephone or over the computer. And everybody expanded their referral networks. Let's go to the next one, please. Services that were available, again, in many situations. This survey had about 1,000 people in it. The majority continued to do their primary care. They continued to do their behavioral health. Many wound up doing a lot of health education, trying to explain to people why they needed COVID vaccines and what COVID was. And where they were able, they continued to do oral and vision health. Let's push on to the next one. Okay, so what are our main takeaways from COVID? And this one's not on that list, but I'm going to add it in. Pre-pandemic, there were a lot of organizations that viewed themselves as competitors. They were in silos. Those silos came down. our best friends are the folks at the nurses and the school nurses and psychologists and counselors and social workers and the community schools and the superintendents and the teachers unions. We all work together to solve the problem. So although we face significant challenges, nearly all of the respondents in our survey, all of our school-based health people, they stayed open and did what they had to do to help their education colleagues. Telehealth is now, everybody's using telehealth. And so where it was an anomaly before, it is the norm now. Our desire, though, is still to fully staff all school-based health centers and to expand them to all Title I schools. And then testing and vaccine follow-up, continues to be an issue. We're very concerned about routine vaccines that weren't given during the COVID crisis and getting kids caught up on that and those and wellness checks as we go forward. So that's kind of a big picture of what's happened with healthcare delivery in schools during COVID. So I'll toss it back to you.
Thanks, Robert. It's a really powerful note to end on. I think that COVID brought about that de-siloing, that the pandemic, with all the bad it brought, it also brought that good of it, forced us to come together. And I also think that ties into what Jose is going to talk about as he goes into full service community schools, what they do, what part they play in delivering services and supports to students, and how they did that throughout the pandemic and how they were acutely able to do that.
No, thank you. Yeah, really appreciate that. I really appreciate the first two presentations that were talked about. I don't have a slide, but let me just tell you a little bit about the Coalition for Community Schools. So we're actually housed at the Institute for Educational Leadership, who's the lead partner of the coalition. As Robert had mentioned, we're a coalition of many diverse organizations at the national, state, and local levels, unions, national intermediaries, governments, you name it. What we really hope for, we're really hoping for a society that actually uses all of its resources, just leverage everything we have more efficiently, effectively, just for the well-being of children and families, not just to do well themselves, but also compel them to do good, serve one another in their local communities. So our mission really is to unite schools and families and communities to create this condition where everybody feels like they belong, that they work together consistently, and they all begin to thrive at how they define that. So our vehicle, it comes to our name, Coalition for Community Schools, our vehicle is actually community schools. So what is that? I like to best describe it as a school, existing school that actually becomes the center of its neighborhood, that actually coordinates relationships and resources in a way that leads to the well-being of all of their children, their students, healthier families in their households and their communities. So during the course of the pandemic, we've all had to adjust, as was mentioned, in one form or another. Mayors looked to school districts when you talk about food insecurities and other services as well, and the school districts who had already started developing community schools look toward their community schools. So what we got a chance to do beginning March 17th through June 2020 is really engage our community school leaders in weekly and sometimes daily dialogues, because everybody was trying to figure this out across the country and across the world. And our community school leaders across the country really stepped up, but they did this in a way where it's in partnership within their school districts, with their community partners, to actually support their children, their families, and their communities, especially those who are most vulnerable during this moment here. So this included ensuring access to food and health care, including the school-based health centers, childcare for essential employees, as we knew that was very, very important, and especially in the first year, and still is. Opportunities for young people to continue to build their social skills. I've heard some things now as we return back to school where even coordination, physical coordination with participating in activities has declined, and how that is affecting children's confidence. But it was also coordinating continuing learning and after-school programs and things that we take for granted who live in urban areas, internet access for learning and employment. Young people were setting up computers in McDonald's parking lots that we learned about. So the pandemic has really shown us how critical that effective coordination of these resources, all these resources we speak about, and how authentic school and family and community partners and partnerships are to caring for our children and for recovery moving forward. So community schools, they were actually able to mobilize very quickly and effectively to support the social, the emotional, the physical well-being and learning needs of our children and their families. The pandemic, what it really brought out was an acceleration and evolution of community schools that highlighted some essential core functions. Communication schools, because of their nature and where their placement is, have a unique advantage in communicating with the broader community in their attendance area who attends there. So they immediately can contact people to find out what it is that folks need, supply that quickly. It also, though, what was needed, another function, is collaboration. As was mentioned also, this can't be done by the schools alone. It's not just their children, their communities, their families, their neighbors. So this took some collaborating with churches, nonprofits, everybody between the public and private sectors. But a key core function that we know, those of us who are project managers, is coordination. So communication, collaboration, coordination. Now there's evidence of the importance of these functions that existed prior to the pandemic, of course, but it wasn't seldom noted. I want to lift those up because that really showed the strength of how quickly, when a school operates as a community school, can care for families in their broader community. A couple examples in that. In Asheville, North Carolina, there's coordinators, community school coordinators, we call them, not to define their title, but to really elucidate what their core function is, coordination. They worked with 45 different local organizations, and they covered over 3,000 volunteer slots they had that were responsible for handing out family food boxes and assembling resiliency kits, they call them, for kids. In Oakland, within a week's notice or less, hosted one of the first vaccinations and resulted in 200 vaccines taking place right in their schoolyard with a week's notice. In the Midwest, Skokie, Illinois, there were 50 staff members that bound together with 47 different volunteers and provided nearly 300 breakfasts and lunch directly to over 240 households 5 days a week, the entire school year, and then the beginning of the next, because as we know, COVID continued. In Cincinnati, Ohio, one of our longer term partners in the movement, was actually providing supplies and meals, but also after school programming in a very safe way, 5 days a week, all the way through the summer of 2021. And they stayed open for the summer for their young people and for their families. And because the importance, as was mentioned, mental health growing, integrating mental health partners to care. So they maintain that summer program to keep the continuity of communication with young people and their families. So we're looking for a systemic transformation. So to do that, Robert was alluding to the Title I school. We need to create a critical mass of our existing public schools working as community schools. So Robert mentioned the Title I. So in our country right now, there's just shy of 100,000 schools. And for those critical mass geeks, we know that it takes about 25-30% of something operating really well. And it won't be long until they all operate that way. So our goal as a coalition is right around growth and quality and sustainability for community schools. That's why we have strong goal of 25,000 community schools by 2025. We're going to do that in a hurry because we lose kids every single day. And so community schools have just been proven to be well positioned to address any catastrophe, but even more important so, well positioned to promote people coming together to develop their own hopes and futures as well. So looking forward to our conversation. Thank you.
Thank you so much, Jose. That was really insightful, and glad to learn more about community schools because they do important work. So now we're going to transition into the Q&A portion. First up, I have a question for Dr. Wilson. As families fell into crisis, children shouldered a lot of the burdens impacting the family, such as watching siblings, sharing food, etc. What do you think we could have done differently with the school meals program that would take some of the burden off the shoulders of children moving forward as we continue to recover from the pandemic?
Well, thanks for that question, and thanks to the other panelists. I mean, I just think coming together to take care of the whole child is what we have to do and get to make it a better environment for children. And in school nutrition, I had said we are a per meal reimbursement program. And we had asked almost instantaneously, many advocacy groups came together, and we went to the previous administration and said, look, please, let's not do this per meal reimbursement. We need to do it as if it's a natural disaster. In a natural disaster, FEMA comes in, they inventory your food, they see what staff you have available, and they let you serve the community as a whole. And then they reimburse the district for the food and the staffing that was used. That's what we should have done. We couldn't get that. And so we had to figure out this craziness of per meal reimbursement. It had to meet the meal pattern with the federal restrictions. So everything was individually packaged. At first, kids had to come and get it before we got a waiver where families could pick up those weekly boxes I talked about. One of the biggest burdens for these children was that their families, their parents were hungry too. The people they were living with, their grandparents, families were hungry, not just children. And so in many situations, particularly when the pandemic first started, school districts turned away adults. It was heartbreaking. And then almost instantly, our district said, forget it. We're not doing this. We've got to feed everybody that comes to the door. So they started feeding adults, but they weren't getting any reimbursement at all from the federal government for all of those meals. And so I think that's one of the biggest things. We need to sit down and figure out how to do this. Not if, but when it happens again. There is a way. We do it with natural disasters. Why we thought this was different, I don't know. Like I said, so many families were in need almost instantaneously, and they had never sought help before. So they were looking to schools as a safe place. What do? I need food. I'm hungry. You can't turn an adult away just because they're over age 18. And so that was an incredible burden these children carried, that they could get food, but they couldn't get food for their parents or their guardians. So there was something wrong with that system. We have to sit down and talk to all of the people that are on this panel and all the other stakeholders that come together to help communities, because this was a community crisis. And the children really did take the burden off of it because so many things were offered for them, but the rest of their family was suffering as well. So I think that was one of the biggest things that we saw, is get rid of the per meal reimbursement nonsense. We don't care who eats food. Everyone needs it, no matter who you are or how old you are.
Thank you so much, Dr. Wilson. Next, Connor has a question for Robert Boyd.
Yeah, so I'm going to target this at Robert, but I also want to, if Jose in particular, but if Katie has any thoughts on this, I would love for anyone to answer this and give perspective. I think it's a bit of a two-pronged question. But Robert, I feel like we were forced to have a perspective change during COVID, but that revealed a lot of underlying issues. It brought up new issues, and then it also forced us to reconsider what we're doing forward. And I think you talked about changing, and Katie, I think everyone did actually, that we can't just stay static in how we support kids. We have to always be moving. So if you have one takeaway rather about what COVID revealed about the past and also reveals about the future. What is your one main takeaway, if you can boil it down to one? Oh, and I'll pass it to I'll do the second question after. Sorry, I think Robert started answering. Tim.
I'm sorry. Dr. Wilson, you really hit on it. We're the greatest nation in the world. We're the greatest food producing nation in the world. We created the internet, yet we have poor people in this country that don't have access to education, quality education, don't have access to food, don't have access to technology, don't have access to healthcare. What can we do differently? Make those things available to everybody, regardless of their capacity to pay for it. This notion of reimbursement, we went through the same thing on the healthcare side. People weren't getting reimbursed. That didn't mean they didn't provide the service. They went ahead and provided it anyway. They just couldn't get reimbursed for it. That's crazy when we're spending so much on our war machines. I don't mean to get on a soapbox, but my goodness, children need to eat, they need to be healthy, and they need to be educated, and they need access to technology. It's that simple. And that we have to wait for a crisis like a pandemic to understand that and fix it. We shouldn't have to do that. It should be an everyday occurrence. And community schools, I think, give us the layout to bring all the resources of the community to bear to make a better community for everybody that has access to it. But forgive me for getting on my soapbox. Jose's used to it, Katie. I'm sorry.
That's okay. Jose, you want to chime in before I say something?
Well, rephrase that question again. It's like, if I could pick one thing, what would that be?
Yeah, what is it that the COVID revealed about the past that informs the future? I guess that what was the norm that COVID, I think, challenged and forced us to reconsider, that going forward, once COVID is hopefully out of our lives, what do we need to change?
I agree with Katie and with Robert. If I added something different, what should change is that during COVID, we were in hyper isolation. We watched our own media. We listened to our own political perspectives. So I think for us moving forward in collaboration, which was highlighted out of all three of us in this transformation, that it's our awesome responsibility as adults to actually model the behaviors we want to see in our children. So I think one thing that COVID really brought out for me and working with community schools is that people put aside politics for a moment, and actually collaborated together. So we can't lose that moving forward. I was sitting in a room with some local Republican and Democrat elected officials, and one of them said, how come we can't agree like this all the time? So the thing that for me is to us to transform is we can't lose working together on the behalf of children.
If I could just chime in very quickly, well, the one thing for us is the norm in school nutrition is that it's the only thing in a school building where a child's family income impacts whether they get access to food or not, or service or not. Everything else in a school building is part of education. You get into the school lunch line and you get a lunch based on what your family income is. It's absolutely criminal in this country that we put children through this. And I think we are really pushing hard with lots of other advocacy groups for universal school meals. We have a lot of pushback on the Hill. There's no reason in this country we can't feed every child, irregardless of family income. And we need to keep pushing forward. We saw that it was effective during the pandemic.
And I'll hop in with a second, unless anyone else has any thoughts they want to follow up with.
Just +1, Katie. Thank you, Dr. Wilson.
+2.
It's been my life mission.
I think we've really hit the gambit of what it takes. It takes a village to raise a kid. I mean, that's a true saying. but it's also a village is very busy. And so I want to tie it into this question of staffing, which I think, Robert, it was 38% of school-based health centers, if I remember correctly, called that their biggest obstacle, which was, I believe, the second or third biggest. I think we hear about how many students go to schools that lack counselors or school nurses or homeless liaisons and so on and so forth, or students who are in classrooms or teachers who are overburdened. In general, I think what do we need from a staffing perspective? What do you all see? And we talked about de-siloing, connecting staff and also supporting staff, but staff do a lot of work. We expect a lot from our school staff.
That's a great question. The number one issue in the health services and schools is workforce. There aren't enough of us, and it's not diverse. You can talk to my colleagues at the nurses or the psychologists or the counselors, and they'll tell you that 90% of their workforce are aging white men. Fantastic people, do a wonderful job, but there aren't enough of them. A lot of them are retiring or bailed during COVID for a lot of reasons. And their help, many of them are licensed, certified professionals. So therefore, they're in competition as a school or as a federally qualified health center with the local hospital or the individual physician. Give you one quick example. School nurses in Denver, they advertised to hire more school nurses, and they advertised $70,000 a year and a $2,500 signing bonus, and went up against the hospital down the street that was paying $90,000 and a $25,000 signing bonus. How do you compete with that? So workforce is critical, but that means we have to start recruiting when they're in middle school. We have to start exposing these kids to opportunities in the workforce, in the school-based workforce. We've got to bring them through high school, picking up the kind of STEM classes that they need to go on to colleges and universities that can train them, certify them, and send them back. The only way you do that, though, is you make sure that they don't have to pay when they go to college. West Virginia's doing it. They've been doing it since the 1990s, and they have retained 86% of the kids that have gone through their programs. And all of them have gone through public colleges and universities at no cost because the legislature bipartisanly said, do it. That's what needs to happen.
I'd love to chime in on that staffing question you had. Is that okay? Mm-hmm. So, I'm impartial already because I'm the director for the Coalition for Community Schools. So you can probably guess what I'm going to say when it comes to staffing. It needs to be somebody's job every day that wakes up of how to bring all these multiple people together to address the array of issues that communities, that children and families are facing, but also to create a regenerative approach for advancing local communities, whether it be workforce, whether it be mental health, whether it be health period, whether it be out of school time, whether it be juvenile justice. Somebody's job as equivalent to you hiring a director of operations or a chief of staff or what have you. We call that person a community school coordinator. That is a unique role, which I would love to see in the Bureau of Labor Statistics one day, which is have the community school coordinator on there. Their main focus is actually to bring people together, identify the challenges, create the solutions together, and go activate that. We did a study when I was in Albuquerque, New Mexico, on a very well-trained, highly functional community school coordinator. And what we learned from that coordinator's input and their ability to coordinate these things brought us, every dollar we invested, brought us a $7.11 return of investment, meaning that they were able to bring people to collaborate together and invest in the children and families at that local school. If we put that across the country, that's actually a new position in our country, a community school coordinator position. I think it's absolutely essential. When we think about the power of a public school and this transformation piece, going back to the last question a little bit, is that name another facility. And Robert, I know you're a pastor and I go to church every week, but you're talking about a school, every single day you have access to people that live in a broader community. we're way underutilizing the communication power of a public school building, but it has to be somebody's job every day. It has to be somebody's job who wakes up every day and say, who do I reach out to today? What do we coordinate today? Who is missing from the table? And that's the community school coordinator. I think that's the key role from my book. And I'm gonna tell you this, everybody on this call here, I haven't always been a community school person. So I learned and started really exercising community school from the out of school time before I started calling it community schools, but from the juvenile justice space, and saw a high school, the largest one here in New Mexico, at the Jalisco Heritage Academy, move from being the #1 referring school to the juvenile detention center to 0 in 6 months by engaging the people closest to the solution, the young people, the families, the teachers. And I saw a for-profit behavioral health agency move from saying we need more kids, which means I hope more kids get kicked out of class, to, you know what, we're going to reinvest and rethink how we support the district on making sure young people are better off. So they, as a community, solved the root cause of why children were coming to the juvenile detention center. But that took a special person, and that person is a community school coordinator.
Mm-hmm. I agree. Yeah, bravo.
Yeah.
Dr. Wilson, did you want to jump in on this question, or should we move to our
I think
final?
you can move on. That's
Okay,
great. They
great.
covered it really well.
So I think we're a little past 4, but I think just to close out, we wanted to just hear your takeaway policy recommendation that people listening or watching can take away from your awesome presentations. So Dr. Wilson, you want to go first?
Yes.
Sure. I mean, I think for me, it's the whole child, and it doesn't matter where you come from, what community you live in, what your family income is. I just think that we have to look at the whole child. What are the needs for this entire community surrounding that child, and really beginning to give those services that are easy to access. And I also think we have to think of the word dignity. I get so frustrated sometimes because we criminalize the fact that somebody's poor or doesn't have the ability to do some of these things. But it's about dignity, and each one of us wants it. So I think policymakers have to get off the high horse and start thinking about what's good for the American people. And I love this idea of what are we going to do to keep kids out of the pipeline of the juvenile justice system? Let's put them in the pipeline of being successful community members. There's a whole different thought process there. And there are things we can do and invest in, but we must invest in children. It's the future. But they need policy. Strong policy is what gets it done.
Oh, can I follow you? Is that okay?
Yeah, do.
Let me follow that, because a strong policy, and you made me think of, I'm going to butcher it, one of my favorite quotes, Thomas Jefferson, talking about our policymakers. He said something around a strong democracy is dependent on a well-informed electorate.
Mm-hmm.
So how do we get there? It's hard for them to lead, so they can't lead with status quo. You can't lead with mediocrity. Even when you're successful, you can't lead with complacency. So you got to lead thinking of a better way every day. And that takes many minds working towards the same goals. So you got to lead with a growth mindset. And so with regards to schools and policy, and I love what you said also, Dr. Wilson, paraphrase, like we're growing children in that growth mindset, and our current care of them actually predetermines what our future is as a nation. So, so transforming our current public school system into a community school system is kind of like rewiring a historical home without turning off the electricity. So the policy, for policies, I would say, going back to the staff question, is like make sure that policy actually explicitly funds that position, that coordinated position, at a level you would pay for somebody that would be your director of operations. Policy that creates more flexibility in the use of these multiple sources that deal with these multiple issues, so local communities can then decide on how to best use them more equitably. That's how we'll achieve that, while maintaining accountability. They will police themselves because they realize that that's their money too. They contribute to that, and policy that actually requires and maybe even incentivizes collaboration amongst public and private sectors at all levels before they can touch that. That would be my policy recommendations.
Katie, send us your legislation and we'll all sign on to it. Feed all kids, educate all kids, provide free health care to all kids that need it. It's that simple. We're the greatest country in the world. It's a sin. It's a shame. It's a travesty to not take care of our kids. I don't know what else to say to that. And all policies ought to be that. That's why I love what you folks and Bruce are doing at First Focus. Let's keep the focus on the kids. They're the future. They're the next generation. And we're failing them. And we've been failing them over and over and over again. We got to break the cycle.
Yeah, thank you so much for that. We always say at First Focus, every issue is a kid's issue.
Right.
So moving forward, always keeping in mind how it impacts kids and how we can improve their futures. So thank you all so much for joining us. We wanted to first thank our panelists for joining today's conversation to highlight the pandemic impacts to child nutrition and education. The COVID-19 pandemic has affected nearly every aspect of a child's life. Over the past month and a half, First Focus on Children has hosted a series of conversations to bring awareness to the impacts of the pandemic on kids. Our goal of this series was to bring awareness to these different challenges and uplift the policy solutions that brought relief to kids at a time when it was desperately needed. You can watch the entire series at firstfocus.org/KCC. We want to thank everyone who tuned in to watch these conversations, our excellent panelists, and the members of Congress who participated. We look forward to working with all of you, as well as congressional and administration leaders, as we continue to create progress for kids.
That'll wrap up today's Kids and COVID conversation. Thanks to all of our panelists. Really appreciated having you here today. I thought that was all incredibly insightful and inspiring about the work we have to do forward. Thank you to Deputy Undersecretary Stacy Dean, who unfortunately we weren't able to show her conversation with Bruce Leslie, but we'll post that interview on firstfocus.org/KCC. And thanks to all our colleagues at First Focus, especially Haley, Tim, Bruce, and Michelle for all your help in planning and tech assistance. And I hope everyone has a great day.